Hi everyone, we have a great case for you this morning. This was we're now 3 months, right? We're 3 months at 3 months? More than that.
I
How
got it
long?
in May.
May? Are you serious?
Yeah.
Didn't you tell me 3 months?
Since we saw her last.
Oh, it was 3 months since we saw you last, so it's been almost 7 months.
Yeah.
I got to do my math there. Maybe it's been 7, maybe it's been a little bit longer. But anyway, so Phoebe came in to see me, and you can see there was some irregularities of the tips of the nose. She had a wide tip with a little bit of a bump. There was poor tip definition, sort of scooped down. You can see that there was width of the tip that she didn't like. Very pretty woman, I might add, by the way. I love her eyes. She's got beautiful facial thirds, wonderful lips, but obviously sort of bothered by her nose. And here she is now, and I'm corrected, 5, 7, 8 or 9 months later. So come on, let's take a look. Here's Phoebe now, 9 or 8 months later. Okay, the tip of the nose is much more narrow. There's no cleft in it as there was before. The projection is proper with the rotation coming up, where there's no bump on the bridge of the nose. She's looking absolutely terrific. Tell me how you're feeling.
Awesome. I forget I got it done.
Isn't that cool?
Yeah.
Yeah, don't you sort of look in the mirror and you're sort of saying, well, this is how I always used to look.
Yeah, I love it. I'm so happy.
Perfect.
Thank
Good.
you.
Any advice, and I'm not asking for solicitation, so don't say anything about me, but can you maybe share with anyone if they're thinking about getting this done, what you might say, or what advice could you give to someone who's thinking about this?
Yeah, I mean, I always kind of wanted one, but it was like a little bit of a joke when I asked my parents about it. And then kind of one day my mom was like, you know what, if it really bothers you, like, let's go for a consultation. So that's when I met Dr. Miller, and after talking to him, it just kind of felt like the right thing to do. It bothered me. I didn't love all like pictures of me in it, depending on, you know, the way I was posed in a picture. So I was definitely nervous leading up to it. I'm not good with medical stuff. But the surgery was the quickest thing ever. I was in pain for maybe 7 minutes right after waking up, and then after that, that was it. The cast came off in 6 days, and it was the easiest thing I've ever been through. People are amazed by how quick the recovery was and the process overall, and it's been amazing. Definitely
Great.
do it if it's something that bothers you.
Now, exactly. Now I'm going to ask you an interesting question.
Yeah.
You ready?
Yes.
What else about your body bothers you?
Yeah, I mean, nothing.
Exactly. And I was just trying to prove a point. I was sort of whispering it to her. It's okay to say nothing. Because that's my point, is that I think I just wanted to address this notion. Some people have, oh, well, you're going to start here, and then you're going to go to the next place, and you're going to go to the next place. And that's not the case at all. There are definitely some people who are obsessed, and I identify that, and I counsel them about how we're going to manage that expectation as well as preoccupation. But for the vast majority of my patients in my practice, there's 1, maybe 2 or 3 things that bother them, and it's just that. They're bothered by it, they want it fixed, and then once it's fixed, I don't see them again until they want Botox and filler. So in another 20 years, you're going to come back for that.
No, this was my only thing. I don't want to do anything else.
Yeah, you don't need to do anything else, and I guess I don't want people to think that it's like starting a drug where you start this and then you get you go on to the next one. That's not the case at all, and I'm glad you were able to share that with our audience.
Yeah.
All right, so Dr. Miller here, another example, and I want to wish everyone a great day. Bye bye. Thank you so much.
Yeah,
that
that's
was
fun.
really